This month is Childhood Cancer Awareness Month, but for the Children's Blood and Cancer Center at Dell Children's, awareness is every day. This year, the American Cancer Society estimates more than 15,000 new cancer cases will be diagnosed in children and adolescents. The Children's Blood and Cancer Center sees 90 to 100 newly diagnosed patients a year. Dr. Dawn Wells is a pediatric hematologist and oncologist with the Children's Blood and Cancer Center at Dell Children's and joins us this morning to help raise awareness with this disease. Good morning to you.
Good morning.
So let's start off with the most common childhood cancers.
Well, leukemias are the most common childhood cancers, accounting for approximately 30% of all cancer diagnoses in children.
So we mentioned how many new patients you guys see each year, but the treatment continues for existing patients as well. So you've got new patients coming in and then ongoing treatment for already existing patients.
Correct.
Okay, so let's next talk about the survival rate. It's higher than it was 20 years ago. What is contributing to this?
Well, better therapies contribute, better use of therapies, improved risk stratification, and better supportive care have all played a big role. And they continue to improve.
Okay, how do adult cancers compare to childhood cancers when it comes to the survival rate?
Survival rates are generally higher in children and adolescents. The chemotherapy seems to be more sensitive, or the tumors that children get seem to be more chemotherapy sensitive, resulting in higher cure rates. So approximately 80% of all children diagnosed with cancer are cured.
Okay. How do you guys help pediatric patients become survivors? What does that process look like from the beginning until the end?
Well, we treated a lot of different types of cancers, and the therapies vary according to diagnosis. But it takes quite the team. So, in addition to pediatric oncologists like myself, the team may involve surgeons, radiation oncologists, pathologists, pediatric oncology nurses, and nurse practitioners. We have psychologists, social workers, child life therapists, and oncologic dietitians. So it takes quite the team and a well-developed program.
Yeah, for sure. How long have you been at Dell Children's and working with?
Well, 19 years in our program, and we became Dell 7 or 8 years ago.
Yeah, I'm sure we could be at Dell Children's every day telling life-changing stories about these children and their families. How would you say adults and children vary when it comes to tackling cancer, and how is it different?
Well, children generally tolerate the very toxic therapies better than adults, just based on their young and healthy organ systems. But also psychologically, the children seem to be quite resilient too. You know, in the immediate, they're worried about it, but in between, they don't seem to care as much. They seem to go back to their lives better.
Yeah, I'm sure many of them facing very scary situations. They probably lift your spirits on a daily basis.
Oh, absolutely.
Well, Dr. Wells, thank you so much for coming in this morning and raising awareness about childhood cancer. We'll have more information on our website later this morning at KXAN.com.